ahead, Lauren, whenever you are ready.
Okay. The phone rings in the middle of the night. You throw your arm to the nightstand and feel around for your phone. It continues ringing. You just can't find it. You roll over and slide up in a daze out of your bed and grab the phone. The number on your phone is not one you recognize. You answer it anyways. Hello? Yes, this is Jennifer's mom. Is this Cindy? She says in a tearful voice. Right away you know something isn't right. Your chest begins to tighten and your senses are alive with warning. You know what this call is about. Your friend has been battling depression for the past few months, and you alone were the sole person she could confide in. She said so many times that she felt as if she had nobody to talk to, and she felt alone. Tears filled your eyes and rolled down your cheeks. You knew you should have done something to help her. Cindy, I'm really sorry. Jennifer committed suicide tonight. She left a note, and in there she said that she wanted me to tell you that she was very sorry. Whether the incidence of teen depression is actually increasing or we're just becoming more aware of it is the fact that depression strikes teenagers far more often than people think, says the authors of Teen Depression, a guide for parents and teachers. Depression is a serious problem and can affect every single aspect of a person's life. They feel fatigued, loss of interest in normal everyday activities they used to enjoy, loss of appetite or possibly overeating, feeling hopeless or worthless, persistent aches and pains, and thoughts of suicide, along with many more other symptoms. Suicide is a main worry among depressed teens and persons, and only 20% of depressed teens get the help that they need. If only 20% do not get the help that they need, imagine the need for all of the people that are depressed. The lack of being diagnosed is not a good enough excuse when people's lives are in stake. In order to find a reasonable solution, we first need to discover the problem. After researching this topic and learning more about it, I think that people who are depressed should receive more funding and help from the government in forms of money or simply just them calling more attention to the problem and helping people become more aware. With 1 out of every 10 cases of depression ending in suicide, I think that along with most of you, that something needs to be done to help those people. Sometimes lending a listening ear just isn't enough. The government needs to provide more funding for not only the diagnosis of depression, but also for the study of it. Today, I will be talking about some of the policies that are being done today to aid people in depression and how we can establish a more practical and efficient plan. The things that are being done currently aren't enough, and this situation needs more attention. The government needs to provide more funding for the diagnosis, treatment, and study of depression. Let me begin with the diagnosis of clinical depression. Without knowing that a patient is depressed, the patient will not seek help in any way, and this could end in dire consequences. I have found multiple sources, and it is thought that 80% of cases of depression go undiagnosed or untreated. This number is alarmingly large. These individuals are depressed and are unaware because of the lack of government funding and overall lack by the population of knowledge of symptoms of depression. In my audience analysis, about half of you, my peers, know somebody who is clinically depressed. But what about the rest of you? Could your siblings or parent be experiencing some minor signs of depression, but you just aren't quite sure? I hope that now I have made it clear to you that we have a problem with the diagnosis of depression. But what about the treatment? A research project done by Kathy Donald Sherborne demonstrates this need clearly. I quote, "Treatment to depressed primary care patients improves short-term and some long-term mental health outcomes." This research project proved that depressed people who are treated have an overall better mental health. If a better overall mental health can be achieved by something this simple, it should be done now, and it should be available to everybody. There are a few forms of treatment out there that I know of. I will mention 2. There are various medications out there to deal with people who are depressed. So you ask, why don't people who are experiencing depression just buy medication? It's not quite that easy. The average cost of medication for depression is about $10 to $70 a month, and there are many more that exceed those amounts. Also, the side effects of depression medication cannot have good consequences. Most families do not have the luxury of being able to spend that type of money on medication monthly. The second form of treatment I will be telling you about is counseling, but the same problem exists here. Counseling sessions cost a lot of money, and most people are not able to afford it, not to mention being able to make an appointment and get it. This does not mean does this mean only people who are wealthy deserve to have adequate treatment? Although insurance does cover some of the costs of these medications and counseling sessions, patients should not have to put out any amount of money. these things should be provided for us. Now, after seeing what things are being done to help people who are depressed currently, we can all agree that there is a need for change. The simple solution to this problem would be to lower expenses of things such as depression medication and therapy sessions, but the money needs to come from somewhere. Currently, NASA is receiving about $19 billion yearly, and the government directs $93 billion towards education in the United States opposing schools. If the government were to take portions of the money directed towards these things and use them to diagnose and treat depression, lives could be saved. With such a simple solution, it is a shock that a plan already hasn't been put into place. I think that a perfect solution to the problem would be a type of rehab. Patients would enter themselves in, or others could suggest that they admit themselves. They would live in a facility and receive treatment daily. After the patients felt comfortable enough to leave, or the doctors released them, they would be able to leave whenever they feel welcome. A question that this plan brings up is, what if the person doesn't believe they are depressed and doesn't think they need help? With these types of clinics, the participation of the patient would have to be 100% their option. Even by starting with only the patients who are seeking help, this is an excellent solution to the lack of treatment available now. Just starting with this specific group could create a large change in the number of untreated patients. Everyone remembers the H1N1 epidemic. The government appropriated $7.65 billion to the Department of Health and Human Services for the 2009 H1N1 outbreak, including a $5.8 billion contingent appropriation for the influenza pandemic. Depression has killed more people than the H1N1 outbreak, but since the flu outbreak was all at once, it was more noticeable. Depression needs to be recognized and studied before more lives are lost. Research your local representatives. Make sure that you vote for people who are willing to redirect your tax money towards a different cause. Contact them and let them know that this is a major issue and it should be recognized by the government as an immediate need. We need to strive for our governments to recognize the immensity of this problem and other problems. Just because depression is not as obvious and not a new problem does not mean that it does not need to be fixed. It has been around for a long time and therefore possibly forgotten by some, but it shouldn't be. The government has so much control over the results of this issue, and each and every one of us has a sole duty to make sure that the officials elected will do something to help people. Now imagine yourself on the phone again, in the middle of the night, woken up from your excellent dream. This time, when you answer, you are talking to your area's local depression clinic. They called you to let you know that your friend has admitted herself into a brand new Depression Watch program and is asking for your support. Your town paid their taxes, and this new facility was set up for them. All of this occurred simply because the government decided to provide a little more funding to the social problem that we all know as depression. Your friend is not charged with any outrageous fees and will eventually be released to go on to living a happier life and also having a better overall mental health. This scenario is much more favorable than the one I presented in the beginning of the speech. A life is saved, and you are not put into the difficult position of being your friend's only support. Providing more funding to research, diagnose, and treat depression is such a simple thing to do that it can save lives. It might even be saving the life of a family member or one of your friends. Let your local politicians know what's important to you. Tell them that everybody is important and that everybody deserves to have treatment of the highest quality. The solution is so simple. Who wouldn't do it to save a life?
Great.